We are in a global health crisis. We have a growing population and we don't have enough people to provide health services.
The number of healthcare workers per population or per thousand in this country is dismally low. It is as low as 20 people per 10,000 population. And we are talking about a population of 1.21 billion. India is growing, economy is booming, but still more than 50% of the population, they live in dire consequences.
We need doctors, we need nurses, but most importantly, we need health workers who can live in the communities they serve, prevent illnesses before they begin, and also provide services at people's doorsteps before illnesses become so bad that people need to go to hospitals and go into debt for them.
We are trying to create a model where a low-cost service in a sustainable setting is possible.
Do it. My duty here is to give health services to the patients here, whoever comes. Second duty is to train people. That's Rekha. And she is the local from the village, and people accept her more than anybody coming from outside. She collaborates with us, we train her. She basically is a link between the people of the village and our whole team.
India is a very diverse country. You're working with people which comes from different education background, different cultural background, different linguistic background. So whenever you want to intervene in a community, you need to work with all the stakeholders involved. You need to work with the local leader, you need to work with the elders of the community. In case of Rekha, you need to work with the mother-in-law, father-in-law, the husband. You need to talk to them, you need to tell them what this person is going to do in this whole project.
गांव के लोकल आदमी ही उसको समझ पाते हैं उनकी प्रॉब्लम को। इसमें फ़ायदा ये है कि लोग अपना जो घर का होता है ना उस पर विश्वास ज़्यादा करता है, ट्रस्ट ज़्यादा करता है। जब बाहर से कोई आएगा तो सोचेगा इसका बहुत ज़्यादा फ़ायदा हो रहा होगा, उस तरफ ज़्यादा ध्यान जाता है।
If you are one of them, they'll listen to you. So that's the whole logic. And you identify a young woman from the community, you identify a young man from the community, train them. That he's going to tell them or she's going to tell them in an informal setting when they are just chatting over a cup of tea. What are the basic things that they can do to improve the health status of the community?
पोलियो में पहले ये था कि हमें घर घर जाते थे, लोगों को कहते थे पोलियो पिला लो, छुपा देते थे बच्चों को, अंदर ले जाते थे कि बच्चा नहीं है यहाँ पे, ये बोलते थे। अब तो डॉक्टर इलाज करते हैं जिसका चिकन पॉक्स का, वो अब खुद आते हैं हमारे पास। संडे को हम बूथ पे पिलाते हैं। बड़े बच्चों में फ़र्क आया है। वो जो मेरे साथ की लेडीज जो मुझसे बड़ी है, टैक्सी उससे आप समझ लो, या फिर वैसे मेंटली ज़्यादा प्रिपेयर हो रहे हैं बच्चे। वही कि शुरू में लड़कियां घबरा जाती हैं पीरियड के टाइम, तो मैंने देखा कि कई बार वो लड़कियां बहुत ज़्यादा रोने लगती हैं, तो मैं उन्हें समझाती हूँ कि ये तो नॉर्मली होना ही है।
When we started intervening, it was difficult, but we were persistent. We said, allow us, we will show you the change.
शुरू में तो बिल्कुल वो नहीं किया, लेकिन अब मेरा पूरा सपोर्ट करें। धीरे कि अब तो तुझे ये काम करना, तो चल मैं भी तेरे साथ हूँ। धीरे धीरे वो मेरे साथ आ गई और घर वालों का भी काफ़ी सपोर्ट है।
This health worker at the ground level, this volunteer, is the important piece of the puzzle, because he or she is going to be there, and he or she can take your initiative forward.
There have been rigorous studies to show that health workers do improve basic child health outcomes. They improve immunization and breastfeeding, and they also can help in treatment for tuberculosis and other chronic conditions. So we have the global evidence, it's a question of the political will.
We need to give them access to the knowledge, to the skills. If we do that, the results are bound to come.